Okay, so hi everyone. Thank you so much for attending our workshop tonight. We know it's a Tuesday and I think it's kind of late being 7:30. So thank you so much for reserving your evening for us. We are just really excited to get to teach you about your pelvic floor and just want you guys to empower you oh, that's totally fine, Erin. Thanks for letting us know. Empower you and educate you on your pelvic floor and your pelvic health. And so I am Tristan Swingle, and I am one of the pelvic floor physical therapists here at Vitality Pelvic Health.
And I'm Nikki. I am the other pelvic floor physical therapist here at Vitality.
And so we are very excited to get to interact with y'all tonight. We want to let you know that we are going to end with a Q&A. So if anything comes up while we're going through the PowerPoint and you have any questions that spark your interest, please put those in the chat. And then we're going to have about 10 minutes at the end where we cover that. So we also want to be respectful of your time. So our goal tonight is to have about 40 minutes overall. So if anything happens, you need to leave, something happens with your kiddos, whatever, that is totally fine. You will also receive a recording of this that will be sent to your email also. So no stress there. But I'm going to go ahead and share my screen.
And we just want to ask everybody if they could mute for us, please. That'd be really helpful.
Perfect. Oh, select window. Here we go. Okay.
Can you guys see that? No.
Well, now everyone's muted. Entire screen. There we go. Now it's sharing in the slideshow. Perfect. Sorry, we're not technological people. This is why we are pelvic floor physical therapists. Okay. You want to go ahead?
Yeah. All right. So again, going back over, we're going to take about 40 minutes of your time. So can somebody unmute and make sure that they can see this?
We can see it.
We can see it.
Thank you.
We appreciate all
we're
of you.
in the dark right now. So our main objective, again, is going to be empower and educate everyone here on the importance of their pelvic floor and just give you some education on how to make more informed decisions when it comes to your health. We're going to go over the functions and anatomy of the pelvic floor as well as the core and how the two relate together. We're going to briefly define pelvic floor dysfunction, talk about common conditions that are associated with the pelvic floor that maybe people don't think about being associated with the pelvic floor. And then we're going to touch on the postpartum and pregnant population as well as the active population.
Okay, so what is the pelvic floor? So the pelvic floor is a bundle of muscles that is connected to the bottom part of your pelvis. And the functions that are associated with your pelvic floor are going to include bowel and bladder control. So that's going to be the ability to empty your bowels and bladder to prevent yourself from involuntarily leaking, either stool, urine, gas, anything like that. And then it's also going to be for sexual function, arousal, orgasm, pelvic organ support, stabilization through your low back and pelvis, and then lastly, circulation. So the pelvic floor actually acts as like a sump pump to circulate blood back to the heart. So there are a lot of things in there that are so important whenever it comes to our pelvic floor. So we want to make sure that it is functioning well.
Okay, so the pelvic floor muscles, they support major organs and also protect them. But coordination of the pelvic floor is pretty key. You need to be able to contract, relax, and lengthen. That contraction is going to help us with peeing, pooping, passing gas, or preventing passing gas involuntarily, which can be embarrassing. And then it helps us relax and sometimes squeeze to empty our bowels and bladder. Lengthening is primarily for childbirth to allow passing through that birth canal. These muscles are also going to support you during that delivery as well. So they're under our voluntary control, unlike our pelvic organs. And onto the anatomy.
Okay, so this is one view of our pelvic floor. And so it's kind of like if we were all cut in half and you looked from the bottom or from the top down. And so you have 3 layers of pelvic floor muscles, and all 3 layers work together for the function of keeping you continent, but also allowing you to empty your bowels and your bladder. They work together for sexual function, and then they also work together for pelvic organ support, like we just talked about. So with the 3 layers, you have your most superficial layer first, which is actually going to be the opposite end of this pelvis that we have here. But your superficial layer, it is for sexual function. So the tissues in your superficial layer during arousal should be engorged with blood to allow for some lengthening and relaxation through your pelvic floor for if you have a female pelvis for penetration. And it allows for engorgement of the tissues if you have a male pelvic floor to allow for erection through the penis. Now, the other thing is it's also going to contribute to the ability to orgasm as you have sexual organs that reside in this layer as well. The other function of the superficial layer is going to be pooping because it has to do with your external anal sphincter. So if you want to relax that external anal sphincter to be able to have a bowel movement, or if you have gas and it doesn't seem like the right time to pass gas and you want to contract that muscle, that is what this layer does. Now then you have the second layer, which is called the deep diaphragm, and the second layer is for bladder continence. So the muscles here are going to compress around your urethra so that you do not involuntarily leak urine, and this can occur with any increase in intra-abdominal pressure, such as like coughing or sneezing, lifting, bending, pushing, pulling. So we want that strong compressor urethra and pelvic floor muscle contraction to prevent ourselves from experiencing an embarrassing leak. And then you have your third layer, which is more of what you're going to see here with this diagram. And the third layer is for pelvic organ support. And this is so important whenever it comes to the muscles, because one of the things that will occur with our pelvic organs is our organs are held up by ligaments. And ligaments contain collagen. And one of the normal age-related changes that we experience is after we turn 25, the collagen production in our body naturally goes down, which is unfortunate in many, many ways, but it's also unfortunate whenever it comes to the stability and support of our organs. So this layer of muscles is not strong to support those pelvic organs, then that can contribute to some different dysfunctions, which we're going to talk about here in a little bit, but causing those organs to want to kind of fall down into and affect the vaginal canal. So we want all of these muscles to be working, all of these layers of muscles to be working together, but we also need these individual layers to be doing their job as well.
And that sort of brings us to the floor of the core. So how we like to describe the pelvic floor as it relates to the rest of the body, the rest of the trunk, is it's the floor of the house. So if you can imagine the pelvic floor being the foundation, and then those abdominal muscles are going to be the front of the house as well as the side of the house. Those back muscles are going to make up the back of the house, and the top, the roof, is going to be your diaphragm, which you use to breathe with. Any dysregulation throughout here can create almost like a dysregulation in pressure, intra-abdominal pressure, that can cause various symptoms of pelvic floor dysfunction, whether it be pain, incontinence, back pain, abdominal pain, prolapse, and so on. And so what exactly is dysfunction?
Yes. Okay. So the official dysfunction of the official definition, I should say, of pelvic floor dysfunction is a broad constellation of symptoms as well as anatomic changes that relate to abnormal function of your pelvic floor muscles. So this can be due to any type of like pain that occurs in those muscles, tension, which is also known as hypertonicity, as well as weakness, which could be hypotonicity, and inappropriate coordination of your pelvic floor muscles. So all of those things together, they can all occur. Usually hypertonicity and hypotonicity do not occur together, but some of these will be just individually occurring or can occur in sequence with others to contribute to different pelvic floor dysfunctions.
and some of those conditions associated with pelvic floor dysfunction. The common ones you hear about are, of course, bladder leakage, bowel leakage, vaginal heaviness, pubic symphysis pain. That's your pubic bone just right on the front there. Urgency or frequency of bladder, bowel, nighttime urination, abdominal separation or coning. That's that diastasis recti that everybody likes to talk about postpartum. But here are just like a list of things that you might hear at the doctor. So like say you go to see your primary care or your OB-GYN, and they're talking about things like a cystocele or a urethrocoele, enterocoele, uterine or vaginal prolapse. These are all things that we can treat with pelvic floor physical therapy, and do not necessarily have to be approached from just the standard medical primary approach.
So Nikki just went over the urologic and gynecologic dysfunctions, but then there's also colorectal. So we have already talked a lot about the functions of the pelvic floor with the bowel. And so any issue with bowels, be it constipation, diarrhea, retention, anything like that can also be a pelvic floor dysfunction, as well as involuntary loss of gas, stool, or urine. And then even a rectal prolapse. So a lot of times we think that a prolapse can only occur into the vaginal canal, but it can also occur through the anus as well. So a lot of times these things we're given a medical option, like that's really the only direction that we can go. But the gold standard is starting to become pelvic floor physical therapy instead of that surgical option, which is great because it's one, much more conservative. You're not going to have the downtime and the recovery time. And so it's always worth, what I will always tell people whenever they come in with some of these different complaints is that it's always better to try conservative first and fail conservative if that's the road that you need to take before jumping into something very official and that you can't change, like a surgery. And then in that general population, you've just got general pelvic pain. Different things like levator spasms, which is spasm around the anus. And then you've also got a proctalgia fugax, which is like also around the anus.
An amazing word.
Yes. And it tends to usually come along with like bowel movements and things like that, as well as any type of like pressure near your perineum or that piece of skin below your vaginal opening. So the nice thing about these two slides is if you are like listening to something or you're concerned that maybe you might be experiencing some of these things, like getting to look back and know what that means and like how you can kind of move forward with it to get more information.
And some of those buzzwords as they relate to pregnancy and postpartum, so things that we hear that relate to these dysfunctions we've just gone over, but you know, different words to describe those things. Heaviness, weakness. I feel unstable. I'm having low back pain that I just can't seem to get rid of no matter like what I do, changing positions, hot packs, you name it. The feeling of falling out. We hear falling out or bulging. I just feel heavy. It gets worse throughout the day and I wake up and it's fine. Or I feel like I'm having abdominal separation. Those are just some things that maybe if you've thought like could be related to your pelvic floor and would warrant an evaluation. Ideal timeframes for our pregnant and postpartum populations. If you're symptomatic, come in as soon as you have symptoms. Come see us. And if you're asymptomatic, we love to see everybody in the third trimester. 33 to 35 weeks is awesome. We can get a good baseline. And then that also allows you to come back in after birth, about 3 to 6 weeks, depending on the specifics of your delivery. And we can figure out, you know, what were you like before? Where are you now? And how do we get you back there? So if that's you, come see us.
Because a lot of times, like with those different things that Nikki is explaining, pain during pregnancy, we're just kind of told that it's normal. And so you'll go to your doctor and you'll tell them that you're experiencing maybe what seems like round ligament pain, or like she mentioned, pubic symphysis pain, like that kind of tearing, separation feeling. And your doctor usually just gives you the solution of, well, you're pregnant, so this is just normal. But many, many pains during pregnancy are actually not normal and are they do really well whenever someone comes in for strengthening, because so many different things are occurring in your body while you're pregnant. And there's muscle imbalances that occur, lengthening that occurs, postural changes. And this is right as what we treat all the time. And then with those timeframes that Nikki mentioned, it's also like, yes, those are our ideal times. We would love to get to see you 3 to 6 weeks postpartum, but once postpartum, always postpartum. So just because you're outside of that 6-week period does not mean that you would not still benefit from pelvic floor physical therapy. It could be 2 months out. It could be 20 years out. It's still something that you should look into for sure. And so with pregnancy and postpartum, that is a lot of times what people are seeking out pelvic floor physical therapy for. And we really love treating that population, and it's really needed. Another population, though, that tends to maybe not necessarily associate pelvic floor dysfunction with what they're experiencing is the active population. And so oftentimes if we're having a lot of these buzzwords here, like if we're experiencing back pain during exercise or we're having pain with intercourse, it's different things that, especially as women, that we just kind of resolve to and we just think is our normal, and we learn to live with it, and we just move on and keep doing our thing. But how great would it be if you were experiencing one of these buzzwords, like urgency or sharp tailbone pain when you were trying to do a back squat or even just lift something up off the floor, and you realized that it was something that could very easily be treated, so that you could do those things without having that dysfunction. And so some of the things that we'll hear people say is like when they have back pain, that it increases with exercise specifically. A lot of that referred pain can really refer into either the buttock, it can go into the inner thigh or the groin. Same with like that achiness or cramping in the pelvis. I mean, that can occur with any activity, also with running. And then we've also got here like the numbness, burning, or saddling or tingling in the saddle. So the saddle is really like your backside, where you're between your low back and your tailbone. And that tailbone area is going to be like right above the butt crack, essentially. So like that location there in that saddle region. And then, I mean, the typical stuff, like I don't have good hip strength. I've got a really weak core. All of these things can definitely be addressed. And so kind of like we talked about ideal time before, if you're experiencing any of these things, it's time to have it checked out for sure. And another way to like kind of know if you would benefit is you've tried other typical interventions. So maybe you've tried over-the-counter meds, you've tried chiropractic care, you have maybe just tried stopping the activity, and it's something that you really love. And so instead of just stopping the things that you love, let's see what's causing your dysfunction and then treat it so that you can get back to doing things you enjoy.
But what usually prompts people to seek help is incontinence. So leaking, jumping, and your whole bladder empties, you know, the amazing things. And who suffers from urinary incontinence? Well, it's very common, but it's not normal. Again, 25% of young women, middle-aged and postmenopausal women, anywhere from 44 to 57. And then women in nursing homes, 75%. The male population, incontinence can vary from anywhere 3 to 11%, with the majority of those men. They typically deal with urgency. So urge incontinence rather than stress incontinence, such as leakage with activity or coughing, sneezing. A lot of that's related to anatomy. But it's a little bit lower, but not unheard of.
And so as you look at these numbers, like that Nikki just talked to you guys through, look at how they progress throughout the lifespan. So, I mean, it starts out a quarter of young women, which is still a significant amount, and then just gradually increasing to women in nursing homes being 75%. That is just such an enormous amount of women who are experiencing bladder leakage. And just like she said, it's common, but it's not normal. And I bet almost everyone can say that they have either said it themselves or been told that if they have leakage that, oh, well, you had babies, or, oh, well, this happened, so this is just normal. And it's really not. And so even if you are experiencing very slight symptoms, we still recommend seeing a pelvic floor physical therapist so that you don't become part of this 75% of older women who are in nursing homes or of nursing home age that are having to can only function in a diaper because they can't control their bladder at all. So just like with anything, the earlier you catch something, the better it is. But then it's still never too late to start. Like if you're at a certain point now and you feel kind of at a helpless point where I don't think I can go, or I don't think I can do anything to really help, it's probably not true. There's always something that we can do. Maybe we won't 100% resolve your symptoms, but we're going to do everything we can to manage them because these are huge things that are going to impact your quality of life. So then kind of going back to the active population, we were like, as we went through the research, 112 elite female athletes, out of 112 of them, over 60% were experiencing stress incontinence, which, like Nikki said, is any type of incontinence with coughing or sneezing, lifting, bending, pushing, pulling, twisting, changing positions. And no correlation to athletic ability was found.
Which is really important.
Yes.
So even within this elite population, it didn't matter how elite they were on paper, they were experiencing 62.5% were experiencing incontinence with probably their career.
Yes. And then, I mean, as you look down at this questionnaire of 290 regularly exercising women, so not elite athletes, and almost 50% were experiencing some type of urinary incontinence. So we mentioned in a couple of slides before the different buzzwords, and especially for that active population, a lot of those buzzwords will often coincide with or precede urinary incontinence in this active population. And even if it's a symptom you're experiencing and it's not your primary symptom that you're worried about, you're like, oh, I'm not as worried about that, but man, the pain with intercourse or my weak hips while I'm exercising, all those things really, I cannot handle. And so if we get to address the main things that are your primary goals and also nip the urinary incontinence in the bud, then it's just a win-win situation there.
All right. So what can you do to help? This, which I love, goes over the relationship between the diaphragm and the pelvic floor. So we want to encourage everybody, and Tristan's going to walk us through a little exercise of how to begin working on proper pressure management. So as you inhale, the diaphragm should descend as well as the pelvic floor. So they move together. And as you exhale, the opposite happens. The diaphragm comes up and contracts, and the pelvic floor should ascend as well. Again, this helps us with that pressure regulation, just perfect intra-abdominal pressure, right? Just everything working together.
And any dysfunction in any of these areas, whenever Nikki talked to you guys through the house of the core being the diaphragm, the top, the pelvic floor, the bottom, but then the back and the abdominals making up the sides, front, and back of that house, if there is dysfunction in one or more of those areas, that is going to impact your ability to appropriately manage your intra-abdominal pressure. And that's when dysfunction follows, be it pain, leakage, prolapse, any of those things. And so we want to make sure that all the sides of the house are optimal, working together so that you have that strong house. And many times that is going to start with the foundation or your pelvic floor. So we've gone through a lot of information today, and we just kind of talked through the way that the pelvic floor and the diaphragm work together. And the great thing about learning about that is, like, how can I start to adore my pelvic floor? Like, what can I do to just start to do it right now? Like, if I'm not going to start this tomorrow. And so what we think that you should do, and one of the most important things that we like to teach our patients, is how to breathe. And it might seem kind of simple and almost even silly of like, well, I breathe all the time. But again, if we've got dysfunction in managing our intra-abdominal pressure or the way that our diaphragm lengthens or our pelvic floor is functioning, then our breath can actually be dysfunctional. And so with breathing, we want that lengthening, that pulling down of your diaphragm to allow for your lungs to fill. But whenever that pulling down is occurring, it is causing your abdominal and your pelvic organs to also come down towards your pelvic floor, which is what's allowing that lengthening process. And so if there is an effect in maybe some weakness in your core or tightness in your back, your breath actually goes to the path of least resistance. So say you're postpartum and you feel like you have an abdominal separation, or you maybe have a big rib flare that followed being pregnant or having a surgery, anything like that. All of these things are going to affect the efficiency of your breath. And so then they can impact the lengthening and the contraction and relaxation of your pelvic floor. And so all of those things can actually occur just with a breath. So what I want all of you to do is you can, if you're sitting in a chair, you can stay in your chair, you can lie on your back in a comfortable position, you can be reclined.
Get your exercise ball.
Yes, anything that you want. So we want you guys to get into a comfortable position. And then I'm going to kind of give you a little bit of a visual. Think about what happens whenever you fill a balloon. So as you blow into the balloon is expanding at the top of the balloon, but also the sides and the top and the bottom. And so that's what's occurring. But instead of the balloon going straight out like it would if we blew it up, it's actually going to be going down. So as you're inhaling, that balloon is filling, and that filling is occurring down into your pelvic floor. So I want everyone to take a nice deep breath, and that breath should be going in all four directions. It should be going down into your diaphragm, out into your abdominals, into your sides, and out to your back, as well as down towards your pelvic floor. Now, as you're going to exhale, you want to exhale all of that air out. And as you're exhaling it, and you're almost like, I don't want to say forcing it out, but as you're exhaling, I want you to think about drawing up through your pelvic floor and contracting it. And it should almost feel as if you're trying to stop the flow of urine or hold back gas. And then you're going to breathe in again. So this isn't something, you're not trying to take the deepest possible breath that you can. We don't need anyone to hyperventilate or anything like that. That's not what we're going for. But to really just be able to intentionally focus on where your breath is going and where you're feeling it. And if you're not feeling it in all of those different locations, like maybe you've got back pain, so you're not really feeling it in your back, or you think you might have some tension in your pelvic floor, so you're not noticing that lengthening. Working on the effectiveness and the efficiency of your breath can make such a difference for your pelvic health. So if you're noticing any dysfunction there, that is a great reason to come in and see us so that we can start to work on that and just really work on the overall optimal function of your core and your pelvic floor. So we believe that this is one of the best ways to start to adore your pelvic floor, is learning how to breathe effectively.
And also, breathing and coordinating it with your movement is huge. So as we were,
just keep going. You're doing great.
So another piece I wanted to add was with that exhale, I like to cue exhale exertion. Mm-hmm. So as you're moving through, maybe let's talk about a squat, mm-hmm. right? So as you're coming down, you're letting that pelvic floor lengthen. You're taking that nice big breath that's going to support all those structures when you're under load. Then when you're bringing that load back up, you're exhaling and you're lifting, and that allows you to exert in a way that also supports your core, muscles, everything as you're coming up out of that. Just a little piece to add it to something functional. Although it's nice to relax on a Tuesday too.
Yes, but so important. Your breath is crucial.
And how we can help. So as we've been saying throughout this whole time, we can perform an initial eval and figure out the source of your symptoms and provide you with a plan of care to help resolve them. Tristan and I, this is what we love to do. We would love to see you all come in or even just chat with you guys. We're excited to start answering some questions as well. If you would like to come in, for people who came to the workshop tonight, we're offering 50% off an initial eval, and you just text 1-8-265-4684 number, and we'll get in touch with you. Also send us your name so we know who we're talking with.
Helpful to know who you
yes.
are.
So Pelvic Jane Doe. And we'll get in contact with you and see if we can get something scheduled, call, talk, see if we could be of help based off of what you're experiencing. And does anybody have any questions, based off of what we've gone over tonight? We're going to check the chat right now.
I can get there. We don't have any questions.
No questions.
Which is totally okay. Because you guys can also text us your questions, anything that you have there. You can text that to us as well. This is our office number. And so, well, good. I'm glad it was informative. Okay, so Megan asked, what do you think about cue pull navel to spine when exercising?
Love that question.
Yes, we love that cue. I would say it is one of the most effective ones.
Mm-hmm.
There's definitely people who it's harder for them to coordinate that. And so we like to change positions for them to get into a better spot. And then we also like to, or just change like our cue, so their hip bones closer together, because physically we can't do that. And that's another way I have them do it if they're on their back. And then if they can't coordinate either one of those, then I tell them to get into hands and knees all fourness of where we are in space. But yes, Megan, love that cue.
On all fours too, I think it helps prevent like stomach, which isn't really what we're trying to do.
Yes.
It just helps coordinate everything. I also like to use, imagine I have a pie in my hand and I'm trying to move your belly button with the pie. And that like also helps cue people in the same way, where they don't get that vacuuming, which is kind of a different effect.
Yes. Okay, we had one. Let's see here. Okay, can having kids make it worse? Can having kids make what worse? Just pelvic floor dysfunction in general? I can go with that. So having kids can impact your pelvic floor. It does not have to cause dysfunction. I mean, there are definitely women out there who have children and do not experience postpartum pelvic floor dysfunction, which is awesome. And I would say like a lot of the things that are more going to contribute to that would be genetics, and depending on how you took care of yourself while you were pregnant, there's going to be a lot of different factors there, method of delivery, preparation, all of that. And so I don't want to say yes, it will always make it worse, but it can definitely, it's trauma to your pelvic floor, regardless of if you have a vaginal or a cesarean. And so that's kind of what we were talking about in terms of postpartum. If you're not sure if you're really experiencing anything, still coming in. And then if you're not, great, then you don't really need us. So we're just excited that you had it checked out and you're okay. And then we got one from Anitra. She said, I tend to hold my pelvic floor muscles tight when I'm standing. Do you have any suggestions to work with this? Do you want to tell them?
The breathing, what we were talking about. So we could also talk about squatting and different stretches. So checking in with your breath when you're standing. An extra layer we can add to that breathing exercise, which I don't think you mentioned, was sort of putting your hand on your perineum. So the space between the piece of skin right below the vaginal opening. You can put your hand down there. And for this, you're going to want to be reclined. You're going to want to be relaxed. And feeling if you can feel the muscles relaxing. They'll kind of descend almost. Not bulge. I don't want you to bulge like you're trying to have a bowel movement, but just see if you can direct that breath in a way that you can feel movement down there, and that's going to help stretch. And now try it in standing. Also just shaking out throughout the day, taking those deep breaths and just relaxing.
I would even say something I tell people whenever they're trying to connect with their pelvic floor is, especially if you're in standing and you don't have the opportunity to sit down, if people are doing a pelvic floor muscle contraction, I kind of tell them to imagine they're trying to pick up a blueberry So if you pick up that blueberry, and maybe it's really hard for you to pick it up, then see if you can just let it go. So you're not trying to push it away from you, but if you know or can tell that you're holding it, then you're just trying to let go of the blueberry. And so to try and visualize that when you're standing might be helpful, but I would definitely implement the different things that Nikki just said for sure. Okay, sneeze, pees when gets worse if you have them after. Oh, yes, bladder leakage in terms of the just having kids make it worse. Having kids can definitely cause increased like incontinence and leakage, be that stress or urgency, nocturia, like going to the bathroom in the middle of the night, and especially leaking with increases in intra-abdominal pressure. So that could be a side effect from having children. Yes. Thank you for your clarification. I'm sorry it took me so long to get to that. Ooh, there you go. Oh, stop screen sharing. Thank you.
You guys don't want to look at
Okay, so do you want to cover that one?
the relationship between the rib cage and pelvic positioning. So that can come back to a lot of things actually, but should I start at the core?
Sure.
Okay. So with the rib cage and pelvic positioning, if you think about, especially postpartum, everything is just stretched out in the abdominals. And what that can do,
You want to get in front?
yeah, I'll get in front. All right. The belly shot, everyone. Okay, no. So what that can do is cause you to lean forward. So it's hard to see on me.
Here, I'm pregnant. You
You're
can do
the
it on
one with
me.
the pregnant belly.
So
okay.
pregnant posture. Here we
The
go.
pregnant posture.
We lean forward.
And what that does is it tips the pelvis forward into this anterior tilt. Here's the front, coming to the side. And so as the abdominals become out through, for whatever reason, that will put us in more of an anterior tilt. This can lead to things like buttocks pain from booty clenching. Tailbone pain can also be associated with either anterior or posterior tilting. If you're somebody who's a abdominal gripper, so somebody who's constantly gripping through your six pack, that can bring the pelvis into more of a posterior tilt, which can start to cause like hammy tightness, more tailbone pain, pain through these sits bones, and again, a deregulation of pressure as well.
Increased pressure on your bladder, leading to more frequency and urgency, all those things. Okay, I think that was all of the questions that we had. So something else that we would like to ask you guys to do, if you don't mind, is you can either put it in the chat or you can also text it, is if there was anything in this Adore Your Pelvic Floor workshop that you felt like you wanted to learn about that maybe we didn't cover. We tried to make it concise and definitely stay within that 40-minute time frame. And so if there was anything you're like, oh, I really wanted to know more about this, please let us know. And we'd love to answer any questions that you have about that or give you further information on that. But it has been 40 minutes, so we do really want to respect all of y'all's time. So thank you so much for spending your Tuesday evening with us. And we hope that you at least took something away from this workshop and look forward to hopefully connecting with some, if not all of you.
Also, just any general feedback is welcome.
Yes.
Just let me know.
Oh, well, I will answer this quick question if we take insurance. So we are actually out of network with all insurances. And the reason that we've done that is so that Nikki and I can always work with you one-on-one.
For a full hour.
Yes. Yeah. You will always be with one of us and you'll never be with a second person. We also do that so that if you are coming in with pelvic floor dysfunction, but we're also finding something with your back or your hips, we're not limited by insurance and we can really treat anything within that realm that we feel from a physical therapy standpoint is connected. So we get a lot of freedom by being a cash pay practice, but we do offer super bills if you were to come in and see us and you still wanted to see if your insurance would help. So we've got different payment plans and packages and options for y'all. So good question for sure. So thank you guys again. We really appreciate it.
Yes,
Enjoy the rest of your night.